Hello, ladies and gentlemen. Welcome to Triple N Media Cardiology Update. I am Dr. NIK NIKAM from Houston, Texas. The feature presentation today is Can Jardiance empagliflozin, a drug used for type 2 diabetes, reduce hospitalizations and deaths in patients with heart failure with reduced heart function, or commonly known as HFrEF. What are some of the major problems we face in patients with heart failure with reduced ejection fraction, or congestive heart failure, or heart failure with flappy heart, dilated heart? As you can see, this is the normal heart. This is the normal heart, and you can see the heart is pretty dilated here. The muscles are thin. They are replaced with the scar tissue. As a result, the pumping function of the heart is tremendously reduced. Normally, the pumping function of the heart is it ejects or pushes forwards 50 to 70% of the blood it receives. But in patients with reduced ejection fraction heart failure, it could be 10%, 15%. I have seen patients with 7% ejection fraction. So that's the scenario in patients with heart failure. In addition to the weakness of the heart muscle, dilated heart chamber with replacement with scar tissue, there are other issues related to the heart failure, namely increased resistance to the blood flow across the main arteries. Along with that, there is also increase in volume overload. Because of the reduced forward output, the amount of fluid removed from the body is reduced. As a result, there is fluid overload, there is salt overload, and there is fluid accumulation in the body in the form of edema. How does Jardiance come into play in patients with diabetes, in patients with heart failure, a medicine that is used for treating primarily diabetes mellitus? Well, if you look at some of the things that are happening in patients with heart failure are helped by Jardiance, which reduces blood sugar level by increasing the amount of glucose excreted in the urine, and along with the glucose, there is excretion of salt and water. So, removal of water and salt adds greatly to the benefit of patients with heart failure in reducing their volume status, salt overload, and reducing peripheral resistance. It's like a perfect help sent for patients with heart failure. With the combination of reducing the blood sugar, reducing the salt in the body, reducing the volume in the body, the patients can function better with this Jardiance when they have heart failure with reduced ejection fractions. So this is a win-win situation. In addition to treating diabetes, you are also improving the symptoms of patients with heart failure with reduced ejection fraction. Here is a study that was reported in the New England Journal in 2020, which involved almost 3,600 patients, 1,800 patients in two groups. The group that was treated with Jardiance, these are all patients with heart failure who had like class 3 or class 4 heart failure. 1,800 treated with Jardiance, 1,800 treated with standard diabetes treatment without Jardiance. And as you can see, over a period of almost 810 days, there was almost a 25% reduction in cardiovascular hospitalizations and death in the group that was treated with Jardiance compared to the group that was treated with conventional treatment without the use of Jardiance. So much so, they even tried this in a small group of patients with diabetes and without diabetes, and even in patients without diabetes who had no high sugar problem, who were treated with Jardiance, who had heart failure, there was a 22% improvement in cardiovascular deaths from heart failure. So this is a significant improvement in outcomes of patients with heart failure when they are treated with Jardiance, whether they have diabetes or they do not have diabetes. However, Jardiance is not a perfect drug. Jardiance has one of the serious side effects, that is ketoacidosis, and it particularly seen in patients who are going for surgery in the immediate perioperative period. Hence, Jardiance should be stopped for at least 3 days before surgery and resumed afterwards when the clinical condition is stable. It is also not recommended in patients with kidney failure with a glomerular filtration rate of less than 30 ml per minute. Jardiance is also contraindicated in patients with type 1 diabetes. I already talked about reduced kidney function, so Jardiance should not be used in patients with type 1 diabetes mellitus. So, ladies and gentlemen, it looks like Jardiance is the perfect drug. Should you be asking your primary doctors and endocrinologists to prescribe Jardiance if you have a history of heart disease, heart failure, and volume overload? That makes perfect sense, but let me caution you, all these new drugs have a pretty high price tag. As you can see, with the GoodRx discount coupon, the average cost is $550 per month. I'm talking about per month. Unless you have a prescription plan, even then it could cost you $50 to $100 per month just for Jardiance. So you have to weigh the advantages versus what the cost is, especially if you are a Medicare patient living on Social Security. So this is a very quick summary of Jardiance and how it helps patients with heart failure and what is the cost involved in treating heart failure patients with Jardiance. Ladies and gentlemen, you have been watching Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston. We have more than 200 cardiology lectures on our Triple N Media site. Please do watch them and please do subscribe to our channel. And I will see you next time with another quick update on cardiology topic.